Thank you everybody for joining us today. My name is Graham Folds and I'm the Regional Director for Laerdal Asia Pacific and the Managing Director for Laerdal Australia and New Zealand. Today I'll be your moderator for this webinar. During the session, if you have any questions, please send them through on the Q&A function. We'll have 15 minutes at the end of the webinar to go through these and have as many as possible answered. All attendees will be muted to minimise background noise. This webinar will also be recorded and you'll get an email with a link to the recording in the next few days. Today, we're privileged to have three internationally renowned speakers. Collectively, they have over 60 years of healthcare simulation experience between them and bring a wealth of expertise, particularly in the area of simulation instructor training. Dr. Marcus Laerdal, who's a qualified anaesthetist and pre-hospital medical specialist, as well as being the founder and CEO of INPAS, Institute for Patient Safety and Simulation Team Training. Dr. Jennifer Keast, who has a PhD in simulation education and currently works as a simulationist at the Royal Melbourne Hospital Clinical School, Department of Medical Education at the University of Melbourne. And Dr. Christian Karcher, who is an intensive care consultant at the Royal Melbourne Hospital, as well as a clinical sub-dean simulation at the University of Melbourne. During this webinar, they'll be sharing why well-trained instructors are the most important aspect of simulations and experience with online simulation instructor training courses. Now, let's welcome our speakers.
Okay, thanks very much, Marcus. I'm Jennifer Keast. I'd like to say good afternoon to everyone and welcome. It's a pleasure to be joining you here today, and many thanks must go to our friends at Laerdal for organising and supporting this event. I do have a disclaimer up front in that I am a faculty member of the International Simulation Instructor course that we'll be talking about later today. Our topic for today is why well-trained instructors are the most important aspect of simulation, and also our experiences with an online instructor course. So I'm starting off our presentation, and my focus today is on the instructor as the learner, what the roles and responsibilities are, why it's such an important role, the skills that we need, and how to go about learning those skills. Whoops, sorry, my slide's not progressing. Sorry about that. As instructors, we have many roles and responsibilities when we design our simulations, which of course includes that all-important debriefing where the learning happens. But there are lots of things that need to be addressed by us as instructors prior to the debrief happening. And when we're thinking about all of those instructional design components of our simulation plan that come first, I'm not sure that we think about them as contributing to the debriefing. I think we often see the debriefing as some sort of separate entity from all of those other things. I mean, it's where the magic happens and the learning happens. But thinking about it, what all of these other design elements are doing, if they've been considered and implemented properly, is to enable the debriefing, to enable providing optimal conditions for learning and setting up not only the participants for a successful debriefing, but also setting ourselves up as instructors for a successful debriefing. So what are these instructional design elements that we need to address to prime our participants for a great debrief? Here they are, and they're probably familiar to many of you. These are the elements that we need to consider. And if we don't create a safe container for learning right from the outset when our participants step through the door, if our learning objectives are not appropriate and are not matched to learning theory, if the simulation action is either too far inside or too far outside of the learner's zone of proximal development, or if we haven't paid attention to managing our participants' extraneous cognitive load, if our fidelity and our facilitation style don't match our learning outcomes, and there are no opportunities for mastery learning within a sim, then what's at huge risk here is the viability of a successful debriefing. We haven't primed our participants. We haven't created optimal learning conditions. And we're starting off our debrief in a kind of negative balance, if you like, and then have to play catch up. You can be a really experienced debriefer. You can ask the most elegant advocacy inquiry questions, but the participants won't be receptive to any of that because of a kind of simulation trauma, if you like. caused by us not paying enough attention to all of these other instructional design components. You know, they're psychologically battered, they're cognitively overloaded, maybe feeling hard done by or even tricked if the case wasn't plausible, a whole range of emotions. And you end up kind of retrieving them from those emotions rather than having an opportunity to shift their frames in the debrief. So these components are really important, and it's only when we've addressed all of them and we've set up optimal conditions for the debrief that we can then go ahead. So what is it that we're trying to achieve within the debriefing? We want to combine the participants' reflections on their experiences in the sim with the facilitator's assessment. As debriefers, we need to make some assessments. We need to assess several things. What it is we want to address in the debrief, what it is the participants want to address in the debrief, and then we need to relate those issues back to real-world practice. In our own minds, as instructors, we need to assess participants' performance against a known standard, and then explore reasons why that standard was or wasn't met. And if it wasn't met, what led to that? We can only shift them towards improved performance if we understand what happened for them in the sim action. Was there a knowledge deficit, an oversight, a fixation error, a lack of experience, a communication mix-up? If we don't explore those elements with our participants, then we can't understand why it happened in the first place, and therefore we can't correct that deficit, whatever it was, and deep learning won't occur. So apply appropriate debriefing techniques will give long-term application of new knowledge and skills a fighting chance, new ways to think for our participants about what happened, and increase the likelihood of FAR transfer back to the real world. And FAR transfer is when new understanding and skills are able to be applied to a wide variety of clinical situations, not just a situation that happens to be identical to the one in the simulation. That would be near transfer. So as you can imagine, there's an art and a science to all of this. There are lots of different debriefing methods, debriefing techniques that are available to underpin reaching these goals. And all of them have common themes and concepts that will support you in creating your debriefing conversations and creating optimal conditions for hopefully sustained and deep and transferable knowledge creation for your participants. So what does it take to become a debriefer? What is it that you need to learn and understand and develop as you progress? Let's take a look at them. You need an understanding of simulation pedagogy, all of the things that we've just talked about, the various theories and concepts that are relevant to simulation, and they might be very different to your other teaching pedagogies. We need to establish and maintain an environment that engages interaction. And again, that's very different from, say, lecturing or other teaching styles that you might currently engage in. And as debriefers, we want to understand everyone's point of view and how a particular action or a decision within the sim not only affected the outcome, but also how it affected the others in the simulation, the rest of the team. What was their take on it? What was their understanding of what happened? And what do they construct from the subsequent discussion in the debriefing? We need to develop facilitator situation awareness, and that's both during the simulation and the debriefing, learning what to focus on and what to pay attention to. And this is where your learning objectives can really support what it is that you need to focus on so you don't get distracted. And also we need to manage our own cognitive load. During the debrief, it can get very overwhelming. Pardon me. And it's easy to lose track. Lose track or lose your train of thought. So again, relying on learning outcomes and debriefing techniques will help you with this until you kind of develop your own style expertise, and then you'll become more adaptable and flexible. But relying on them in the early stages is what will support your debrief. You need to ask the right questions in the best way at the right time. And at first, this is really challenging, but it is the crux of the debriefing. Asking the questions in such a way that maintains that safe container, but also allows you to disclose your judgment as the instructor. So what will you need to develop? What does it take to do all of this? You need to adopt a stance of curiosity, always, being genuinely interested in what happened and why. You need to use good judgment. As I've said, you as the expert need to decide on what standard you expect in your learners, in their performance, and then explore why that did or didn't happen. And having established that safe container for learning, and by using appropriate questioning techniques, you'll be able to hold your learners in the highest regard whilst also holding them to the highest standards. And that's what we're trying to do. You need to explore emotions. Participants are often in a highly charged state during the sim and during the debrief. And these emotions need to be appropriately managed. And in fact, that emotional energy can be harnessed to guide the discussion. The same can be said for conflict management, especially when you've got strong personalities and strong opinions being voiced in the debrief. It's really important to judge an action and not an individual. And you also need to explore the decision-making process so that that's what you end up critiquing rather than the outcome. And of course, crowd control. You may have several participants in the sim, several observers watching on. So in the debrief, they all want to contribute. And we want to look at the simulation action through a lens of multiple perspectives. So everyone's opinion is considered, and you need to strike a balance then to keep things fair. And like all new skills, all of this requires understanding and training, opportunities for practice and feedback and reflection. So how do you learn to do it? There are several ways, as you can see here. And importantly, we need to remember that even though we might be content experts from a clinical perspective, we're still very much novices when we start out in simulation as instructors. And we need to learn all of these things I've just talked about. So we can do that through faculty development programs, simulation fellowships, peer review, watching others, watching yourself, debriefing on video, and also through reflective practice, thinking about the needs of your participants and reflecting on the actions that you use to facilitate learning. And then there are conference workshops and online modules. But for me, the thing that underpins all of these activities and the thing that made the biggest difference to my skills was undertaking a formal instructor training course. And I'd encourage anyone involved in simulation to do that if you have an opportunity. And then all of these other things listed here then build on that foundation. So that's it for me. I hope I've conveyed my message to you about what it takes to be an instructor and how to go about achieving those skills. Please post any questions in the chat and we'll moderate them later. And I'll now hand to Christian for his presentation. Thanks for your attention.
I would like to start by thanking the organizers of this and for the kind introduction and giving us all the opportunity to share some of our experience. I've got the opportunity here to hijack this talk and talk about the transition of skills learned in the simulation lab to the real world. Trying to answer the question why debriefing skills are also important outside of the simulation lab. So I'm an intensive care specialist and I'm the clinical subdean for simulation. So I spend part of my working days in the simulation lab and the other part in the intensive care unit. My disclaimer is that I'm also an instructor on the InFact simulation instructor course. When I think about the things that a good instructor needs to know, then I'm thinking of the 3 Ds, so of design, delivery, and the debriefing of simulation. And Jennifer has been talking about the educational underpinning and the structure of designing simulations, and also touched on debriefing. Delivery really covers the technical aspects and the facilitation style. But to me, obviously, the most important thing is the debriefing where the learning occurs. What we know from our colleagues and our students and learners is that healthcare workers these days are increasingly trained in simulation and exposed to simulation-based education and debriefing. And what is interesting over the years is that we see that the learners that we work with in the clinical workspace expect of us just the same level of feedback and debriefing as they know from the simulation lab. So here it's really about transfer of debriefing skills that you already learned and that you practiced in the sim lab, and how you can take them and in what situations you can apply them in the clinical workplace. And at the bottom here, there are just 4 examples. So I might be having a difficult conversation with an underperforming trainee, someone who's constantly late, or someone who's constantly making bad clinical judgment. There could be conflict between staff within our unit or with external stakeholders that have to be moderated and mediated. Obviously, working in intensive care, there's a reasonable chance that any given day an adverse event or a traumatic event occurs, and we often do post-emergency or post-crisis debriefings, and for all of those, good debriefing skills are important. Debriefing also, there's an increase in interest in the literature on the topic of debriefing of real world situations. And this is just one example by Keith Cooper and colleagues from the intensive care field, where they did a systematic review a couple of years ago in a meta-analysis and looked at the impact that structured debriefing can have on clinical outcomes. It's pretty much the same with simulation. Everyone seems to be liking it, so it's well received. It does improve learning, and there are positive outcomes in terms of non-technical and technical performance. The patient-focused outcomes, it's that literature body around this topic is mainly around outcomes from cardiopulmonary resuscitation. And you can imagine that survival with good neurological outcome is a pretty complex beast, and it would be difficult to pin that down to just the effect of good debriefing after CPR, because it's more than just pushing at the right depth at the right rate. When we debrief in the clinical space, we describe hot debriefings and cold debriefings. And a hot debriefing is one that occurs usually straight after an emergency or after a traumatic event, or at least within hours, but certainly within the same shift. The purpose of it is to provide psychological support to team members, checking in whether everyone is okay. We usually identify major system failures, be it a faulty piece of equipment or a trolley that wasn't set up in the way that we would have expected it. But we don't go much deeper into an analysis. And often that's sort of at the level of an plus delta. What are the things that we did well, and what are the things we can do better? So the format is really impromptu. It's usually in an empty cubicle or in a small conference room. And the people involved is the immediate team that was involved in the clinical care. The data we use for those debriefings is based on clinical recall. And that's why it's important to do it early after the event, because obviously recall fades or memory fades over time. And those hot debriefings can then, in selected cases, or when we think either because they're clinically interesting or particularly challenging, or they were psychologically particularly challenging, then we transfer those into a cold debriefing. And the cold debriefing generally occurs within ideally 2 weeks of the event, so memory is still reasonably fresh, but gives us time to work up some of the details of what happened. The purpose now is more, and this is more leaning towards and post-simulation debriefing on deep reflective learning. We often focus on human factors and crisis resource management issues, and conduct a much deeper analysis of any system failures. The format is more formal, and on top of the immediate team that is available, we would have a larger team that could be ICU wide, for instance, or we have external teams invited to those debriefings if there were stakeholders. Again, the data is in most cases still based on clinical recall, but we're making a good attempt to getting solid data from the events. So we might interrogate machinery such as defibrillators, monitors, an electronic recording system, etc., to support the debriefing. At the bottom, it says video assisted, and that is something we're not doing routinely because we're obviously not routinely recording everything that happens in the ICU, but we're currently undertaking this qualitative study exploring that exact issue, the staff perception that of routine audio-video recording in the intensive care unit. And amongst all the themes that come up in this, there is this one of debriefing of clinical events. And our learners, our staff members, this is ICU nurses and ICU doctors, tell us that they would absolutely value the ability to debrief clinical events. So they're saying things like being able to review real life emergencies and having a debrief would be invaluable. And the other thing that comes up regularly is that although they like it, they would want to make sure that the person who debriefs is actually trained. And here comes the importance of a simulation or a debriefer course into play. The people doing the debriefings would need to be trained so that it's not a finger pointing exercise. And I think that comment highlights previous experience by staff because, and we're potentially guilty of that ourselves, but we certainly in our careers have experienced bad feedback. And it's actually, and by that I don't mean negative feedback, I mean feedback delivered badly. And that is unfortunately quite common still. This here is well known to everyone. This is the famous bullshit sandwich. And the nurse recently told me the hospital occasionally doesn't even provide the bread for this type of feedback. So when we look at feedback and debriefing, it's important to, I think, understand what we mean by those terms and where the difference is. With feedback, we often look at the superficial issues. We would look at observable behaviors. We identify what the learner said and what the learner did, but it never goes to the point that we explore what they were thinking at the time. So the type of feedback or the technique that we would be using would generally be in plus delta feedback, short and snappy. And if it was to be any bidirectional feedback, then we would use in Pendleton. Debriefing, however, goes much deeper. In debriefing, we're really interested in what the learners or the practitioners' frames are. What was it that motivated them? What's their rationale for the actions that we observed? And what we achieve with debriefing is encouraging really double loop learning, deep reflective thinking, and exploration of those underlying frames. So the dilemma, however, we have is that not everything goes swimmingly well in the real world, and it doesn't in simulation. So there's the dilemma that we occasionally have to get a critical message across or share our experience as simulation instructors or debriefers in the real world, and make sure that we're maintaining the relationship and allowing our learners or our staff members or colleagues to maintain their faith. And that is particularly challenging in the real world, because in a simulation course, you might meet a learner for a day or two maximum, but then you might not see them again. Whereas the long-term relationships can really be damaged if you don't do the debriefing in real life properly. And the way that I would like to explore some of those issues is along this course that we're running at the Royal Melbourne. This is a 2-day interprofessional course, Effective Management of Intensive Care Crisis, where we have ICU nurses, registrars, and consultants coming. It's a course that has some components of skill training, but it's very heavy on scenario-based immersive simulation around human factors and crisis resource management. And here are some experience that we have had over the years. So the challenge for the instructor in this course is that we're creating fairly complex scenarios, and multidisciplinary teams work in these scenarios together. And those are clinicians that come from all across the country and internationally. So they often don't know each other, and they met each other an hour before they have to jump into a simulation scenario. So naturally, by creating complex scenarios and those team factors, the stress levels are high, and we push them occasionally towards the edge of their comfort zone. We also get very senior clinicians, and senior clinicians often come with big opinions and big egos. And then every now and then we get sent what we call a problem child, which could be, for instance, a trainee who seems to be struggling and gets a pat on the shoulder by their supervisor and says, go to the Royal Melbourne to this EMIC course, and they'll teach you how to operate better in a crisis, or how to communicate more effectively. So you can see this mix here is the perfect recipe for challenging debriefings. And when you look at those dot points, this is exactly what you get on any given day in a clinical workspace as well. So what is it? Jen touched on what a good debriefer is, and just to highlight that, what is a bad debriefer is one that is not trained, one that is not briefed on the issues that they're supposed to debrief, or what is a good debriefer knows what the important things are that are worthwhile debriefing, and which are the things that are not worth going into greatest detail. And we often have co-debriefers for specific simulations, be it gynecology or cardiology simulations, and we have a content expert with us as on the faculty. And the experience that we have made over the years is that the most senior content expert believe that they're also the best debriefer in the world, and that couldn't be any further from the truth, unfortunately. Which also again highlights that debriefing isn't skill that you have to learn, and that's important again for the clinical workspace. The way that I would describe that is a real life traumatic situation debriefing is probably sort of the difficult airway of debriefing, and you wouldn't send anyone in who hasn't got any airway skills to manage that. So what does a bad debriefer generally do? Well, firstly, they usually not genuinely curious. They put their ego in front of most things, and that leads them to often being judgmental. That can then deteriorate into a degree of blaming and shaming. And if there's conflict within a team, then they often create or make it worse rather than diffuse that confrontation. And a bad debriefing will ultimately lead to bad learning or no learning. It will increase psychological stress and harm, create distrust between the learner and the debriefer, or the clinician debriefer and the staff member. And ultimately, when you look at courses, then it will cause bad publicity, and in the workspace, it will certainly harm your workplace culture, staff retention, etc. So to sum up, what can a good debriefing as opposing to what a bad debriefing does achieve? Well, firstly, we think it normalizes debriefing, and that is a cultural shift that we would like to implement even more in the clinical workspace. That is absolute normal to be debriefed on a regular basis. We want to stimulate reflection, enable that double loop learning, and ultimately change frames and behaviors, which then we would hope, and the literature would support, that enhanced learning and would improve outcomes. With that, I thank you very much, and I'll hand over to Markus.
Yes, thank you very much, Christian. Thank you for listening. So my disclaimer is I have been in anesthesia for 17 years at the University Hospital in Tübingen, And since 8 years, I'm the founder and CEO of the Institute of Patient Safety and Team Training, running kind of my own company in doing that, what we did at the university before. And I'm the founding president of the German Society for Simulation and Healthcare. So we have a lot of experience in simulation. We did simulation in almost all areas of acute medicine in the last 20 years. And very early on, together with Peter Diekmann and many international faculties at that time, we did lots of simulation courses. So we trained up to now more than 3,200 simulation instructors around the world in all different fields of medicine. And we had different teams, different places, different areas, clinical, preclinical, pre-hospital, and all fields from giving birth to anesthesia, ICU, and stuff like this. So we really liked these instructor courses. And as you know, we always met physically and we were training and discussing and interacting, and we loved to do it. So everything was good until the coronavirus hit us and we got the shutdown. So of course, we stopped all instructor courses. And we were thinking that you cannot run instructor courses online. That's just not possible. But then someone asked us, couldn't you do some sort of online instructor training for our team, because we are shut down, we cannot do anything, our teachers are sitting around, couldn't you do some educational stuff for us? So we said, no, that's not possible. But then they came back again and said, we're still sitting around, please, I'm sure you can do something online. So we were starting to think, starting our brains and thinking, what could we do in an online instructor course? And so the online instructor course evolved, and we were thinking, what are the most difficult and critical parts of being an instructor? And as Jennifer and Christian already mentioned, the goal is achieving deep learning effects, and that's kind of not trivial. The recognition and discussion of human factors, crew resource management issues, which might not be so familiar to many clinicians. Stimulating constructive discussions in the teams during the debriefing, let's say prevention and management of difficult debriefing situations, and at the end to be successful and having fun debriefings, with the final aim to enhance patient safety, improving teamwork, having more fun at work, and more satisfaction. So these are the measures we wanted to achieve. And then looking at these kind of tasks and skills, we thought, well, we can achieve that online, even so we cannot run the simulations. So we developed the course further, and we said, okay, it must be highly interactive. There must be lots of experiential learning. We cannot do lectures for instructor training. We need to embed CRM aspects, the team issues. And we would need exercises for debriefing in role play with individual feedback to every participant. So let's see an example. I just wanted to show you how we do that in our online courses. So for example, we have a workshop where we look at the observation of CRM in clinical care. So here is a little video I want to share with you and just give you a little look at how that works in our courses. So we would give the instructor course participants the task, okay, now in the next minute, look at the team here who are performing CPR on a patient, which we took the video especially to train people on observing CRM in clinical teams. So the team has names. Mary is the nurse who called the emergency team, and John and Sarah are the ones who are coming to help. So we tell the participants, please focus on the CRM key points, which we discussed and introduced earlier, of course. So we divide the groups, 3 to 5 groups, depending on the number of participants, looking at 1 to 5 of these CRM key points. So every group has its task, and then we start with the video. And I just wanted to play this video for you that you can see how that works in our course. And I hope that the audio is running on the video now.
Okay, it's ventricular fibrillation. We have to resuscitate. Someone has to fetch a defib. Come on, guys. Someone has to fetch the defib.
Okay. Is it still in the equipment room, right?
We also need an IV bag.
Okay.
Hey, where the heck is the defib? We need it urgently.
I already brought it. It's right behind you.
Okay, so that would be the video clip, and now the team would discuss the CRM issues which they saw, the good and the bad, and then we would go on after the small group work, gather the different CRM key points, the good and the bad, and discuss aspects of CRM in this clinical context. Then following such an exercise, we would go to, for example, a debriefing workshop, and we would also use, for example, the video you just saw and say, now we are doing debriefing training. You saw a little scenario, and we have the names again of the team here, and then we do a role play debriefing exercise. And that's kind of one of the main things we do in the online instructor courses. So we divide up in small groups. So if you are a course with 12, we would divide up in 3 groups. If you are a course with 20, we would divide up into 5 groups. So as you can see here in the slide, we have now our participants. And just to explain that to you, here would be the faculty. And now we have a participant in role play being in the role of John. We have a participant being in the role of Sarah, and we have the participant exercising debriefing. So this guy is now doing a debriefing of John and Sarah, and he will get feedback from the faculty. So, and doing this kind of exercise online proved to be very effective. It's very effective. So participants really like it. They say it's like private coaching, private teaching. Quite a few participants said they like this more than being in a real course, in a face-to-face course, because no one is looking, they are for themselves, they have no group pressure. One of the participants who did the first part of the course face-to-face and the second online said, you know, it was pretty challenging in the face-to-face course, sitting there, 12 people looking at you, and you're trying to pose a question, and in the online course you're alone at home, only you and the webcam. So of course, what is missing in an online instructor course? We don't run scenarios. So you don't get the experience to run scenarios sitting in the control room and doing all that. We do not exercise to set up simulations, to prepare the room and stuff like this. Handling the audio video system, we don't practice that and experience the scenarios as a participant. And of course, having a drink and dinner after the course. So we really love to go out with the participants after the course, or at least hang a little bit around and socialize. But what we saw is, if you are working in a sim center and you have simulation activities going on, then you can have all that what is missing in the online course at home in your sim center. And perhaps most of you already have simulation experience or can get that in a sim center, being accompanied by more experienced people who run the show, who run the simulation, do like this. So So we were running a lot of instructor courses online, and people really loved it. We were really surprised. As I said at the beginning, we thought it's not doable. You can't run online instructor courses for simulation. But it proved that we can do that we can focus on the most critical aspects of being a debriefer, and that people really like it. So most of the participants are surprised. They didn't expect so high interactivity, interaction, such a lot of personalized individual small group feedback. So they really liked it. And of course, they also liked it not being necessarily to travel, to organize the private life and everything. So now, having had this good experience with these online courses in the German-speaking countries, we thought it's time to put that on an international level. And so we designed this international instructor course with faculty like Christian and Jennifer, but also many others. David Gaba is kind of our most experienced faculty. So our international instructor course is designed to be fully qualifying program. It's highly interactive, debriefing in focus, many small group video exercises as I just demonstrated. You get personal contact to faculty members. We are organizing private video conferencings 1-by-1 with faculty for each participant. Of course, we talk about scenario design, and you get individual feedback on scenarios which you designed, so you can send in your scenarios and faculty will discuss that with you. And the course is running over a period of several months. I will just show that in a second, so that there are different learning events over a few months. So it's not a course, a classic course. It's more kind of a simulation instructor development program. And it's intended to start a course network and to have regular alumni meetings for all course participants over years. Because it's international, globally, we run the course in 3 time zones. So there's one course for the Australia Pacific area time zone, and one course for the European EMA, Middle East Africa time zone, and one for the Americas time zone. So there's the link. We will show that later. And just to show you again how we stage this course from our experience is you have a 2-day instructor course online, which kind of gives the basic skills and knowledge and a lot of exercises. Then there are 4 weeks approximately in between the next event where you get assignments, develop a scenario according to the course, and then another 2-day course. So this is kind of covering the core to start, but then we have kind of 2 months in between. You get individual coaching with faculty in these 2 months. Then there's a refresher and transfer half day for the course participants. So you're in your course again. Then after 3 months, you also get coaching with the faculty. And then there's kind of a fine-tuning half day, what is still missing, where are still problems. And we continue with kind of every half year an alumni networking meeting with courses, lectures, exercises to improve the things. So benefits of the new online course in our view is you have to have a lot of international experts as faculty. You have small group interactive exercises. You get lots of experiential learning and individual feedback, as I showed you in our video example. You get input for learning theory, how to prevent difficult debriefing situations, and scenario design, and all skills for successful debriefings. And as I said, it's a longer term program. It's not just a one-time course and then you are on your own. You will be in a community to help you getting better and better on a long-term basis. So now, after that, before we start the discussion, I would like to hand over to Jennifer again to kind of wrap up this and look at the course in the context of the learning needs for an instructor, which Jennifer was talking about at the beginning. So Jennifer, I show you a slide.
Great, thanks so much, Marcus. I spoke earlier about formal instructor courses and the one that I did being such a game changer for me. So what would I look for now if I was starting out? Well, I'd actually look for all of the things that I'd expect in a well-planned simulation, all of the things that I mentioned earlier. And based on those requirements, I can see many advantages educationally in a longitudinal online instructor course. And Marcus has already mentioned some of these. The participants that he's already had have given him feedback about some of these advantages, but I'd just kind of like to summarise them for you. Next slide, please, Marcus.
Yes.
From a longitudinal perspective, which this course is, I think receiving high dose, low frequency exposure to learning definitely optimises the time spent in the course, because it maximises time for reflection and application during the 4-week or the 3-month break, whatever it is that Marcus just described, between the different activities. And often in a massed short course, say over 4 or 5 days, there's not enough time to digest and reflect and practice before the kind of next new lot of learning is upon you. So in some ways, you're not able to give the content the attention that it deserves. And in that same vein, the instruction in the course needs to change and become more diverse and more complex as your zone of proximal development changes in line with your growing expertise. And that takes time, and you need opportunities to practice and develop. So a course that addresses those changes through variable sequencing and scaffolding and opportunities for practice in between the didactic sessions then supports you in different ways at different times as you need it. And this also helps with extraneous cognitive load, as you don't feel so overwhelmed by kind of too much information being packed into a course at the same time. The longitudinal nature of the course also has really strong links to the concept, I think, of a cognitive apprenticeship, where, as Marcus said, the instructors who are teaching you become more like coaches and mentors, and they can adapt as they get to know you better over a period of time, and also as they get to know your clinical environment and your particular challenges when you come back to them after a period of debriefing practice for more guidance. Next slide, please, Marcus.
Yes.
From the perspective of being online, I think all of us have been really surprised this year by things like learner engagement and learner interaction since we've been delivering various programs online. And indeed, like Marcus, what we've found is that a lot of aspects of online delivery are actually superior to face-to-face teaching. And I think in particular, again, there's much less extraneous cognitive load, as Marcus also said, when you're participating from the comfort of your own home, compared to participating in a group. And I think this is especially so when you're performing new skills like debriefing techniques in front of others. So there's definitely a decrease in performance pressure, and we know that things like performance pressure and extraneous cognitive load inhibit learning. And also what happens in a face-to-face debriefing course is that you have to perform in a simulation in front of others so that that simulation action can then be used as a trigger for the debriefing discussion. And for me, that also adds performance pressure and kind of takes the focus away from the main learning objective of learning how to debrief. So recorded trigger videos that you view online also decrease that stress. And obviously from a practical perspective, especially now, online learning complements a longitudinal course in that you don't have to travel to return to base camp every few months for ongoing tuition. So it makes life a lot easier. And just the last slide, please, Marcus. So, oh, sorry, something's missing from that slide.
You mean this?
Yes, thank you. Great. What a relief. What I've done here is taken Marcus's timeline and turned it around to make it a learning progression for the participants in the international instructor course. It's a diagrammatic representation of what our course looks like along a learning progression trajectory, where the didactic content kind of intersects along that progression and takes into account changes to our learner's zone of proximal development. So all the way along between novice to expert practice, the content is appropriate and timely over the duration of the course. So I'll just leave that image with you and hand back to Graham.
I've got a series of questions for our panelists. Actually, go back that slide because it's quite. I'll come back to that last slide. It's somewhat serendipitous that this has appeared today. First question, Jennifer. I think you've answered very, very nicely, but I'll ask it again anyway. What constitutes a good simulation instructor course?
Wow, that's a big question, kind of like what constitutes a good wedding. I think there are so many facets to it. The person, I think it was Raylene that asked that question, I'm wondering whether she meant a good instructor course or a simulation session that she's planning to run.
I think she's talking about an instructor course is how I interpret the question.
Right, okay. So I think probably 4 things. You need to know your learners. You need to understand their zone of proximal development and what their learning needs are. You need to have a really good plan that addresses all aspects of instructional design, whether that be an instructor course or a simulation session for learners in simulation. You need appropriately trained simulation staff to be able to deliver an instructor course with lots of simulation and instruction and debriefing experience under their belt. And you need to rehearse, have a really strong plan about who's saying what and when, and how different components of the course articulate into the next section. So that's kind of my just off the cuff response to that question.
Thank you. I've got a series of questions, so we'll move on. There's a question here from Mary Lee Moore. I completely understand the focus on debriefing and love the sound of online course for debriefing, but I'm a little bit surprised that you all seem to be dismissing the participation in the actual scenarios contributing any learning and simulation. Any comments? And also, isn't the stress and performance anxiety experienced in-person course of value?
Yes, I would say, of course, there are components which are not covered in the online course. As we said, we are not running scenarios yet. You know, we were thinking about running virtual scenarios, getting people in action. But the decision was to focus on the debriefing skills, on the CRM observation skills, on the management of the participants. We do discuss scenario design, but we do not run scenarios. And yes, so you're completely right with your question. This is a component which has to be performed where you are in your simulation center. And we highly recommend that instructors participate in scenarios, that they feel how it feels to be in this scenario, what problems arise in this scenario. And of course, having the experience being debriefed, sitting in the debriefing room, being debriefed, looking at your own video is a good experience. And I think that should be done for the instructors. But up to now, we cannot run that in the international courses. But what we see, what the biggest problem of the instructors is, what over the years on all meetings, simulation meetings, we always see a big need for, we want to improve our debriefing skills. So, and of course, scenario design, how to run scenarios is also an issue, but how can we improve debriefing? So being online, we can provide a lot of intensive debriefing, training and feedback. And the other things also have to be in mind. That would be my stance on that.
No, very good answer. I've got several other questions.
Oh, sorry.
Go, Jennifer, please.
So I just wanted to add onto the performance pressure second part of that question. And I think performance pressure is really important for people who are learning after they've learnt the basics. And my kind of analogy about that would be teaching a medical student about hypotension and not wanting any performance pressure on them while they're learning the management of it in simulation, compared to then an anaesthetic or an intensive care registrar managing hypotension with performance pressure, because they then have the knowledge of how to experience it. So as a novice learner, I think you need to take out extraneous cognitive load and take out performance pressure until you've got the basics under your belt, and then add it in as you progress.
Thank you. Great example. I'll pose this question to Christian, and the second part of it to Marcus. What do you believe are the top 3 skills or competencies of a world-class simulation instructor? The top 3. You could list 10, I'm sure, but what are the top 3?
Curiosity, curiosity, and curiosity. Those are my top 3. And I mean that quite seriously because both in simulation and in the real world, it is really about having this genuine stance of curiosity, not identifying an issue for the purpose of having identified it, but identifying it in order to understand what occurred. And I'm paraphrasing, I think some wise man once said that errors are mysteries to be discovered or explained and not to be punished.
Okay.
I didn't paraphrase that well. I find the quote and put it in the chat, sorry.
Marcus, how does your instructor training course develop curiosity, curiosity, curiosity? I was looking for free, but yeah.
Yeah, actually, we are focusing on that, no doubt. As we said, main part is learning how to debrief, doing exercises on debriefing with difficult levels of difficulties through the course. So that's a big topic, to focus instructors on being curious about why things happened. Why did our participant think this is a good idea, what they did? So it doesn't really matter if it was wrong or right. It's about finding out why they thought it's a good idea. And this is achieved by the curiosity Christian mentioned. And kind of the other component perhaps is to in quotation, love your participants. As an instructor, we should be happy that we have the opportunity to have our learners here for a day and to try to make them learn as much as possible for their work, for their patients. So it doesn't matter if you like this person or not, you like them as a learner in your course. And you are really curious about their mind, about their mental models. And this is what we want to find out first: diagnosis of behavior, what was the mental model, and then perhaps give opportunities to change this mental model in the way of improving systematically. Yeah.
Excellent. Serendipitously, this morning at about 3 a.m., the American Heart Association released their 2020 resuscitation guidelines and updates on resuscitation training. Christian, you'll appreciate that one of your colleagues, Professor Peter Morley, one of the senior people in ILCOR, the International Liaison Committee on Resuscitation, actually presented at this world-leading event. And they characterised 4 characteristics of really good resuscitation training programs. And they spoke about spaced learning, deliberate practice, mastery learning, and bolus training. I'm happy to share with anybody the actual infographic about their guidelines for new and advanced resuscitation training. I'd like to once again say, actually, before I conclude, if on the screen, I think you can see dates for when Marcus, Christian, and Jen are going to be running the INFAC course again, their contact details. They're more than happy to take questions. Just contact them by email if you want some more information about the program they'll be running in February. So once again, we'd like to thank Marcus, Jennifer, Christian, and all attendees for joining our live webinar today. We will send out an email with a link to access the recording over the next few days. Our next Sun webinar will be on the 5th of November with Dr. KT Waxman, who will present some tips and strategies on how to use simulation remotely to meet course learning objectives. And we also have a special virtual Sun session next week on the 28th of October at 2 p.m. Please join us for an engaging and informative discussion with a team of global experts who will share how to apply the actual standards of best practice in a virtual environment. And please visit our Laerdal website for further information on these webinars. Thank you, and see you at the next Sun webinar. Thanks, everybody.
Thank you.
Thank you.
Take care.
Bye.
Goodbye.